Okay, so we're going to look at the antibiotics for the Robert May case. A quick kind of summary of the learning objectives. There's really four main drug classes that you have to be aware of for this particular patient's disease, which you guys will talk about in the live session. This particular disease is best treated by one of these four classes of antibiotics. So when you look at macrolides, azithromycin has been shown to be clinically useful for this disease. Within the tetracycline class, doxycycline is kind of the standard therapeutic approach. Likewise, within the fluoroquinolone class, ciprofloxacin is the main drug. And then our old friends, sulfamethoxazole and trimethoprim, which basically inhibit folate metabolism, are also quite beneficial for this particular disease. So just as a recap, azithromycin, remember, if you will, it's a macrolide antibiotic. It mechanistically inhibits the 50S ribosomal subunit. And it can be broad spectrum and bacteriostatic, but when you increase the dose, and we've seen this in a lot of different antibacterial type of agents, that when you increase the dose, this bacteriostatic drug becomes bactericidal at some of these higher doses. And also azithromycin has been shown to have a time-dependent killing as well. Azithromycin is relatively well tolerated. There's also few drug-drug interactions that exist with it. It's got a really long half-life, so single doses can be pretty effective. Main side effects include GI upset and ototoxicity, usually like a herring in the ear, or hearing disturbances, or tinnitus, or ringing in the ears. You can see cardiac arrhythmias, and so if you've got maybe an older patient who has some type of underlying cardiac pathology, which we'll learn about soon, you may want to give them a little quality control check on the EKG before you administer something like azithromycin. Other infections can be treated with macrolides, particularly azithromycin. Those other infections are listed here. So when you look at your differential, perhaps maybe some of those bugs can be causing this particular infection, perhaps not. But just keep that in mind, that when we talk about specific drugs, it's not just the use of this particular drug in this specific disease. You'll see these drugs used again and again. And that was the case with sulfamethoxazole and trimethoprim. We keep using it in all these different cases. Doxycycline, remember, is a tetracycline antibiotic. So it's going to inhibit the ribosomal subunit, but it's going to inhibit a different molecular target. Now we're looking at the 30S. Like before, this particular drug is broad spectrum. At the lower doses, it is bacteriostatic, but when you increase the dose, then this becomes bactericidal. There is a pharmacokinetic absorption alteration that you should be aware of. Is that basically when you co-administer doxycycline and tetracyclines as well, with a high amount of what we call divalent cations, so magnesium, calcium, and a few others, the absorption is going to be dramatically reduced. So think of like food interactions, milk, yogurt, ice cream, cheese. You wouldn't really want to take doxycycline with those foods. Likewise, maybe for an older patient, wouldn't want to take doxycycline with something like over-the-counter Tums, which has a lot of calcium, magnesium, and aluminum in it. Also, to be aware, in the younger sexually active patient, there is a drug-drug interaction with oral contraceptives in doxycycline. Basically, doxycycline reduces the effectiveness of the oral contraceptive, and so you should counsel the patient if they perhaps are sexually active, especially female. You would definitely tell them to use a secondary method of birth control. It does have really good oral absorption, over 90%, but you can also use it IV. And then the side effects are listed there. The main side effect that we typically think about with doxycycline and tetracycline is light sensitivity, as well as bone discoloration and deformities. And there's a classic story of young kids that are in rural parts of the world. Their mother maybe didn't know she was pregnant at the time and was treated for some type of minor infection, and then the kid has basically eroded enamel and kind of lifelong sufferer of persistent cavities. So there can be dramatic bone and teeth discolorations, and you really see it on the enamel in the teeth per se. Other infections that are treated with the tetracycline antibiotics, of which doxycycline is one of them, include this long list. And then another drug that we should be familiar with is ciprofloxacin. It's under the brand name Cipro. You've probably heard of it or taken it at some point. And this is a fluoroquinolone antibiotic, and so it's got a different mechanism of action than the other two. It's going to inhibit the DNA gyrase, also known as topoisomerase, and this will disrupt the kind of integrity and the stability of DNA. Ciprofloxacin offers concentration or concentration-dependent killing, and it is bactericidal. It does have a high degree of oral absorption. The two main side effects that you should be familiar with ciprofloxacin include a CNS toxicity, so a heightening intensity of dementia is possible, as well as a cardiotoxicity. And then also kind of unique and rare is articular damage, and so you can kind of see where this would be contraindicated in children as well as pregnant women as well. The infections that are commonly treated with fluoroquinolones are listed here. Several years ago, there was an anthrax scare, and the government and some people were kind of stockpiling ciprofloxacin for combating and treating anthrax as a bioterror type of event. And this is just kind of to remind you, we've talked a little bit about, increasing the dose of a lot of these antibiotics produces kind of a change in the outcome, in the clinical outcome. And so, at moderate doses, you can see an inhibition of growth, and that is associated with bacteriostatic antibiotics. Then when you increase the dose, then that effect changes and you see bactericidal. So you go from inhibiting growth to flat out killing bacterial cells. So that's kind of a nuance to some of these drugs. And I think I made an announcement maybe last week quoting a 16th or 15th century pharmacologist who said, it's the dose that makes the poison. And namely, this is true. Trimethoprim and sulfamethoxazole we have talked about continually. I just wanted to kind of draw your attention to it and kind of remind you. And again, these two drugs are they're co-administered together. It's a single capsule or tablet. I think it's a capsule. And both of these drugs are in the same capsule in this particular ratio of 1 to 5. So one molecule of trimethoprim for every 5 molecules of sulfamethoxazole. And again, this is another treatment strategy for this particular bug that's bothering Ryan May. And just some memory aids in terms of how to keep all this straight. Tricycles have 3 wheels, right? And doxycycline inhibits the 30S subunit, so doxycycline 33. Ciprofloxacin targets the topoisomerase enzyme. Another name for the topoisomerase enzyme is DNA gyrase. And of course, anytime you can apply it to food, especially here in Chicago, gyrase reminds me of, I think you would call it gyros, but in Greek it's pronounced gyros. I'm Greek, so I know. And whenever I can have one, they're good, except a little too much garlic for some people. So those are just kind of 2 cool memory aids that I came up with to help you guys remember. So that's it for Ryan May. That's the 4 main kind of drug classes. And hopefully when you go into the CBCL session with your clinical facilitator, you've got a short differential in terms of what bug is ailing Mr. May. So thanks, and email me with any questions. And again, sorry for the delay. I thought this was posted.